So today, the Ohio Department of Health discussed the concerning spike in COVID cases we're seeing across our state.
And as those cases rise, so do hospitalizations. 2 News reporter Madeline Ashley is live here in the studio with the message from health officials about how to turn these growing numbers around.
Mark Brook, Ohio Medical Director Dr. Bruce Vanderhoff says we're taking an unfortunate turn with more than 3,000 cases reported daily in the last week. While these numbers aren't the highest we've seen, Dr. Vanderhoff says they're comparable to numbers we saw last winter. ODH Director Dr. Bruce Vanderhoff concerned with the Delta variant surge we're seeing in Ohio.
Ohio's cases per 100,000 have been averaged over 2 weeks. And they now sit at well north of 400.
These case numbers, a stark contrast to July, when Dr. Vanderhoff says we were seeing around 17 per 100,000.
We are now more than 25 times that number. Now more than 100 cases per 100,000 residents, and some are upwards of 1,000.
Hospitalization rates now 10 times higher than early July.
With more than 2,500 Ohioans battling COVID in the hospital right now. This includes more than 750 in the ICU.
Many of these hospitalizations, children.
A year ago, we would have a handful of kids in the hospital who were with us for other conditions and happened to have COVID. Now what we're starting to see is kids in the hospital, including the ICU, who are there because of COVID.
Dr. Vanderhoff says while this isn't the direction we want to head, there are ways to lower these numbers.
Most notably, choosing to be vaccinated, but also choosing to wear a mask in situations where appropriate distancing simply can't be maintained.
Currently, ODH leaders report a little over 52% of Ohioans have begun the vaccination process, with over 48% fully vaccinated. In the studio, Madeline Ashley, 2 News working for you.